I'm not going to spend hardly any time on this, except please note on this side. This is a disclosure of biases. For the last 12 years, I've done most of my work in low and middle income countries, and one of the things that's helped me understand is, wow, are we ever rich? We have so much money, that's not our problem. Our problem is how we spend it. Interoperability is a governance problem pretending to be a technical problem. Oh, look, the Canadians apologizing again. I'm sorry. Any of you that have heard me talk about this topic before, I'm like a dog with a sock. It's not like the technology isn't a little bit complicated, but that's not why we struggle with interoperability. It's because of the governance. So I'm going to unpack this. It's not just a pithy saying, I'm not just a guy with big ears. We can in fact look at this a little bit and say there's axes of governance along technical and behavioral lines, and then there's instruments of governance that are in our hands. Legislation and policy, funding and payments, and conformance testing. All right, I get it. This is a busy slide. So I highlighted the things that you should really pay attention to, including 4 of the 5 C's. When we're talking about the technical access, this is where we get rewarded for adopting standards. And when I teach this, I teach the 5 C's. 4 of them are here. Content specs, coding specs, communication specs. We're in a regulated industry. Confidentiality is important. So the technical access really is how will we select from the sometimes quite wide portfolio of standards that are available to us. That's where the governance comes in. You have to figure out how you're going to do this. What's your definition of success? What's the criteria you're going to use? And the only wrong answer is to not pick one. Keep in mind, this is the technical stuff. They'll always make it work, but pick your spec, stick to it. And a lot of people are being very forward-looking and future-looking and saying, I want to go with fire. You totally should do that. Just pony up to the fact that you are going to have to work with the fire community, because a bunch of that stuff is still getting baked. How do we govern along the behavioral axis? So this is important. The 5th C, by the way, is care guidelines. So if I'm diabetic, there's a number of people in a number of different organizations in a number of different places in the care delivery network that are all going to be helping look after me. If I'm the one who's diabetic, it's about me. And so we have to coordinate that all of these activities are adherent to the best practices regarding diabetic care. So this governance of the care guideline is a behavioral agreement that everybody's going to play their part in my care. This is person-centric. Well, there's other things that actually maybe should have been on the technical slide, but when there's going to be interoperability, there's going to be data sharing. Well, when does that happen? What is the trigger? What are the mandatory behaviors of the initiating system? What are the mandatory behaviors of the receiving system? Are there particular exceptions that they should trap and that they should raise a flare about? So what are those mandatory behaviors? How should the sender and the receiver conduct this transaction so we ensure that it's safely done? There should be encryption, for example, of all the data that's moving over the wire. And then what are the post conditions that are mandatory? Who's ever had to suffer through a course in database engineering? The ACID properties. The content has to be atomic. At the end of it, it has to be consistent and independent and durable. So there has to be, I have to go from one stable state to another stable state as part of an interoperable transaction set. What are some of our instruments of governance? And we had some fantastic news yesterday that we're progressing in Europe on the legal basis, the legislative framework that we're going to use for our interoperability. I can tell you with some joy that Canada's also made some huge progress in the last year. A policy document, not a piece of legislation. I wish it were a little bit stronger, but it's not. But I had the opportunity to, not sure if I should talk out of school a little bit and say who the country is, but I'm going to, just don't tell them. I was advising the government of the Philippines in 2015, 2016, something like that. And one of the problems that we had in the Philippines is that the legal basis for sharing data was that you could not share the data of a Filipino without the explicit informed consent of that Filipino. On a peso basis, about 60% of the care was being provided by the private sector. They did not want to share their customer lists. It's as simple as that. They had the same problem in America. They had to bring in anti-data hoarding legislation in the USA to address this particular problem. And I made a recommendation. We did all kinds of good technical work, and we had a blueprint, and I told them it wasn't going to work unless they changed the law. And I told them to reframe it as a rights issue, that every Filipino had a right to patient-safe, high-quality care, and in order to get patient-safe, high-quality care, the data about that Filipino had to be shared within the care delivery network. And that was something that you could opt out of, but you didn't have to opt in. Shared for the purpose of delivering them care. You can't enroll them in a clinical trial, you can't do marketing to them, but for the purpose of care delivery, you had to share it. It took 4 years, 5 years almost, before they changed the law, but they did. And now they're able to proceed with a national data sharing infrastructure. What are our other instruments of, oh, wait a minute. There we go. Interoperability can be framed as a funding issue. Trust me when I tell you, everybody pays attention to their paycheck. Everybody. It is the most important lever in the hands of our ministries of health, and how you pay and when you pay and who you pay, that will actually be an instrument of change in the care delivery network if you need to make change happen. So in the US, they brought in incentive funding. By the way, they did something very useful around the adoption of electronic medical records in the US. They did it in 3 phases. You got a bit of a bonus if you went early, didn't matter at all if you were in the middle, and they had a penalty if you were a latecomer. They used the carrot and the stick, or maybe they beat them with the carrots, or I don't know, something like that. We've never been willing to use anything but carrots in Canada. It's a problem. You would think we would, well, actually, no, you wouldn't think that we would also be willing to use a stick. We're Canadians. I just made a joke. In the US, you get points for doing e-prescribing. You get points for doing electronic discharge notes. And when you reach a certain threshold, you get money. And it's very motivating for them. Okay, I just quoted Ronald Reagan. There it is. Trust but verify. Conformance testing is an instrument of governance in your care delivery networks. What you want is for every digital health solution that's going to be part of your ecosystem to be demonstrably able to follow the rules that you have set, the specifications that you've identified. You not only would you not want somebody who's going to be a weak link in the overall chain, but it's not a safe thing if somebody can corrupt the data that we're all going to be relying on for better care. So conformance testing is a really important thing. This is just a lot of blah, blah, blah. I don't know who actually read it while I was talking, but this is from, it's Clause 30, Article 30 of the proposed legislation. And let's all live in hope that it's going to be able to make its way through the European Parliament unscathed. Okay, I wanted to do an example. Look at how fast I'm going. I expect to be impressing you right now, because this is going to be taking longer, but I'm going. All right, I had an opportunity to see from the inside how the COVID certificate project proceeded. Now, I was an invited insider because I wasn't a member of the European team. I was a member of the WHO team, but we were working quite collaboratively together. I can tell you, and I'm only speaking out of school a little bit, that WHO as a governance organization is challenged. It is a membership organization with 194 members, and it became very clear that our European teammates were going to lap us, basically. They were able to go about 6 months sooner in their release of the specifications than the WHO team was able to go. But let's look down the list here. We were able to successfully, within the European team and eventually within the WHO team, to come up with our standards. Our content coding, the representation is because it was a QR code, if everybody remembers. The representation, the communication standards, all of that was developed, and quickly, very quickly. It was urgent. Our societies were shut down. This was a big deal. The technical specs related to the QR code and the operation of the PKI-based trust network, that's my fourth C now, the confidentiality piece, that got sorted out, and then, and this is a big thing, and then an open source reference implementation was built. That was something that was a regional public good. It could be used by every member state, and it was. And there's no lowering the bar. We had to make sure that we could do this right. So you never lower the bar, but you're really allowed to give people a ladder. That's fair. We weren't trying to prevent market entrance. We wanted to make sure everybody could do this right. And I want to point to this especially with a big red arrow, apparently, because we just saw at the end of the 12 to 1 o'clock session a very short demonstration of a whole bunch of open source assets that have come out of the Unicom project and are made available to absolutely everybody who has to be able to succeed at this. You don't lower the bar, but it's a great idea to provide a stepladder. The common legal basis was established in the European Parliament, and money was provided so that every national system could be connected to the open source stack that they all used. And then conformance testing was done. Not only did you purport to be able to connect to this trust network that had been established across Europe, but you demonstrably and successfully did it, and you followed the rules, and you built QR codes that could be read by everybody else. And that was a big deal. Okay, I want to end on a hopeful note. Where there is an agreed desire for an outcome, and that outcome relies on interoperability, then I think we can get people excited about it. We can get public money invested in it. We can get the attention span is consumed and devoted to things like this. I actually lament a little bit how much interoperability is talked about as an end, because it isn't. Better health for all Europeans is an end that we can and should be very excited about. And interoperability is a way to get that. And I wish a little bit that we were talking more about the benefit statement and less about the means. Interoperability is a means to this end. And when we're focused on that value proposition, I think we can more easily overcome the friction on the governance side.